Prayer is not asking, it is a longing of the soul. A wish to pray is a prayer in itself. Let us rise and invoke God's blessings on us through a prayer song. I request the fourth year BSc students to lead us into prayer. Thank you, dear students, for helping us in the prayer service. Small cheer and great welcome makes a merry feast. May I now like to call upon Professor Mr. Anil Kumar CM, Vice Principal, SGS College of Nursing Sciences, to welcome the gathering.
A warm good morning to one and all here. I take this opportunity to welcome invited guests, teachers, and my dear students for this regional seminar. I would like to first welcome Dr. Amarnath Sorake, Founder President, Dr. Rajini Sorake, President of SCS Group of Institutions, in their absence. I'd like to take this opportunity to express our hearty welcome to Mrs. Frida D'Souza, Manager, Hospital Operations, Srinivas Hospital, Mukka, for honoring our invitation to be the chief guest for this function. I welcome you, ma'am. I call upon Ms. Donna Benny to offer sapling to madam. I'm glad to respectfully and cordially welcome Dr. Abhinay Sorake, Secretary, SCS Group of Institution, for presiding over this function. I welcome you, sir. I call upon Ms. Anne Mary to offer sapling to sir. I extend my hearty welcome to Mr. UK College, Administrative Officer, SCS Group of Institutions, to this function. Welcome you, sir. I call upon Ms. Akila PB to offer sapling. It's my pleasure to welcome Professor Mrs. Lolita S.M. D'Souza, Principal, SCS College of Nursing Sciences, the backbone of today's function. Welcome you, ma'am. I call upon Ms. Steffi to offer a flower to madam. Extend warm welcome to our organizing chairperson of this seminar, Professor Ambika J.R. We welcome you, ma'am. I call upon Ms. Sara to offer flower to madam. I also welcome Organizing Secretary of this seminar, Mrs. Sifali Josna Bagin. I welcome you, ma'am. I call upon Ms. Susanna to offer flower to madam. I extend my warm welcome to today's organizers, Nursing Management Department, 4th year coordinators, and 4th year BSc Nursing students to this seminar. My hearty welcome to all the delegates, HODs, teaching and non-teaching staff and students for sparing your few hours of your valuable time to come here and to witness this seminar. We welcome you all. I also extend a warm welcome to media, press, V4 channel, sounds and system, and the food arrangers to this program. Once again, I extend hearty welcome to all of you. Thank you.
Thank you, sir. A warm welcome to you too. I call upon Ms. Aparna, student, 4th year BSc Nursing, to offer a flower to sir. In the right light, at the right time, everything is extraordinary. As an indication to bright start the seminar and illuminate the minds of the students, I request the dignitaries to light the lamp. I also request Ms. Jerin Thomas, Student Organizing Secretary, and Ms. Preeti Mol, Delegate Representative, to join the dignitaries to light the lamp. Thank you, dignitaries. May the light of this lamp illuminate our path and guide us towards truth, knowledge, and wisdom. May I now invite our respected principal, Professor Mrs. Lolita S.M. D'Souza, to address the gathering on this occasion.
Good morning, everyone gathered here, dignitaries on the dais, distinguished guests, organizers, faculty, and dear students. Firstly, I would like to thank our resource person for the day, Mrs. Frida D'Souza, for willingly accepting our invitation when I asked Madam to come over and address us. She has willingly accepted it. Thank you, ma'am. As a result of the growing demand for healthcare, increasing costs, and evidence of variation in quality of care, the interest in the quantitative assessment of healthcare quality has increased. Furthermore, today's society demands ever more transparency, which requires the healthcare sector as well as other public sectors to provide insight into their performance. Different stakeholders may use quality of care information for different purposes. Healthcare professionals use it to evaluate their performance in order to improve quality. To this end, validated and clinically relevant quality indicators have huge potential to substantially improve the quality and efficiency of patient care across the country. This has become a foundation of a growing effort to improve the quality of healthcare. Continuous nursing quality improvement is the key to care excellence to match with the paradigm shift in roles of healthcare professionals. Expectations from consumers and technological advancements in healthcare, safety and quality are integral aspects of nursing care continuum. Keeping this in mind, this seminar will enable the participants to implement the best practices during their clinical practice. Thank you.
Thank you, ma'am, for sharing your thoughts and insights. STS College of Nursing Sciences was started in the year 1994. The college is affiliated to Rajiv Gandhi University of Health Sciences, Bangalore, and is recognized by the Karnataka State Nursing Council and Indian Nursing Council. STS College has completed 30 successful years of imparting education and training in the field of nursing. Since inception, the STS College of Nursing Sciences has witnessed enormous expansion by successfully adding more and more new courses which provide excellent career opportunities. On the special occasion of completing 30 successful years of inception, the college will debut its anthem today. The college would like to acknowledge its heartfelt gratitude to the composer and lyricist, Mr. Ivan C. Montero, music director, Mr. Roshan D'Souza, videographer and designer, Mr. Ivan Pereira, the faculty and the students who were involved in making of the anthem. May I now request our chief guest, Mrs. Frida D'Souza, along with the dignitaries to inaugurate and release the college anthem. Let us all rise and clap for this beautiful occasion.
Praise the felicitate the choir members of the institution, that is the students of GNM and BSc Nursing, who have sung the college anthem with their melodious voice. So now, I call upon the students to come and receive the momentum from our distinguished guest. So now I call upon Mr. Dr. Abhinay Sorake, Presiding Officer, to felicitate the following students. So Delisha Carol D'Souza, Ratan Joshua, Gladwin Jose, thank you, sir. Now I call upon Mr. UK Khalid, Administrative Officer, to felicitate the following students. Basil J. Parambil, Sherlyn D'Souza, Bibin Shemi, thank you, sir. Now I call upon our principal, ma'am, Professor Lolita S.M. D'Souza, to felicitate the students. Sonu Anna Thomas Rutti, Rekit Macklin Pinto, and Vijay K. Thank you, ma'am.
The Trained Nurses Association of India, in collaboration with the SNA unit of Karnataka State Branch, had organized various state-level sports and cultural competitions by the theme Shaurya and Josh at SEA College of Nursing, Bangalore. We are proud to announce that the students of our college have secured prizes in various state-level events. May I now call upon Ms. Manisha to do the honors.
Now, we would like to take this opportunity to felicitate the winners of SNA state level competition, which was held at Bangalore on 26 August 2023. I would like to call upon Mr. Abhinay Sorake, Secretary of SCS Group of Institutions, to distribute the prizes to the winners. SNA Personality Contest, first prize, Ms. Sherlyn S. D'Souza. Javelin throw, second prize, Mr. Basil Raju. Meter race, second prize, Mr. Vishnu Manoj. Four into 100 meters relay, second prize, Vishnu, Kalpi, Vishnu and Christy. His competition, third prize, Mr. Rekit, Jarin and Anashwara. Thank you, sir.
here's a brief introduction on the resource person for today. It's a great pleasure to have a noble personality as the resource person for this regional seminar in the likes of Mrs. Frida D'Souza. Madam has secured her qualifications in MSc, MBA, MHA, and postgraduate diploma in medical law and ethics. Her hobbies include reading books, elocution, debating, etc. Furthermore, Madam is a national level debater and has also been the state level volleyball captain. To add on, Madam has been the faculty for various quality programs, seminars, and workshops at the state and national levels. She has conducted various audits and has contributed by writing Hospital Infection Control Manual under the banner of CAHO. Madam has worked in various capacities as quality executive at PES Medical College and as an associate manager operations at KMC Hospitals. Presently, Madam is the manager of hospital operations at Srinivas Hospital, Mukka. In recognition to Madam's achievements, we would like to felicitate her. May I now call upon Dr. Abhinay Sorake, Secretary, SGS Group of Institutions, along with the dignitaries to felicitate Mrs. Frida D'Souza. Thank you. With due respect, may I now call upon the presiding officer of today's program, Dr. Abhinay Sorake, Secretary, STS Group of Institutions, to deliver the presidential address.
A very good morning to all of you present here, dignitaries on the dais, invitees, faculty and students. Firstly, I would like to congratulate our principal, Lolita S.M. D'Souza, for organizing this program today for the benefit of the students. I would also like to welcome our chairperson, Professor Ambika, organizing secretary, Mrs. Shifali, and the fourth year BSc Nursing students to this gathering. So information on quality care plays a central role in healthcare in the present times. Nurses are an integral member of the healthcare team and are a unique position to detect quality of care issues and provide avenues for change in progress and improve quality and safety in healthcare. Nurses not only are members of the quality team, but often lead and coordinate efforts at the local levels that provide input into these efforts. The topic chosen for the seminar will enable our students to enrich their knowledge and apply the same when they work in the clinics. The topic is a need of the hour and to improve the quality care for patients and in hospitals as well. The college can organize such events which will benefit society at large. So I would like all of you to take this opportunity to improve your healthcare techniques and to learn from this seminar from our resource person. Thank you.
As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. May I now call upon Mrs. Shifali Josna Bhagian, organizing secretary of the seminar, to propose the word of thanks.
He is good, his love endures forever. Good morning to one and all. I, Mrs. Shifali, lecturer, Medical Surgical Department, deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Firstly, I would like to thank Almighty God for making today's occasion a resounding success. First and foremost, I thank our chief guest, Mrs. Frida D'Souza, Manager, Hospital Operation, Srinivas Hospital, Mukka, who despite her busy schedule has found time to grace this occasion. Thank you, ma'am. And I also express my heartfelt thanks to our founder president, Dr. Amarnath Sorake, and Dr. Rajani Sorake, president, SCS Group of Institution. I also express my heartfelt thanks to Dr. Abhinay Sorake, Secretary, SCS Group of Institution, for presiding over the function. Thank you, sir. We are grateful to our Administrative Officer, Mr. U.K. Khalid, SCS Group of Institution. I thank him for his hospitality and continued support. Thank you, sir. I express my heartfelt thanks to our beloved principal, Professor Lolita S.M. D'Souza, who had given us constant support and encouragement throughout the conduct of seminar and make it a grand success. Thank you, ma'am. I would like to thank our Vice Principal, Professor Anil Kumar CM, for his kindness, his interest, and for his valuable contribution. Thank you, sir. I also thank our organizing chairperson, Professor Ambika Jayar, for a constant support, guidance, encouragement throughout the seminar. Thank you, ma'am. I also thank the guests for their presence. I also thank our Master of Ceremony, Mr. Rekit Maclean Pinto, 4th year BSc Nursing student. My heartfelt thanks to the HODs of the various departments, all faculty, for being part of this seminar. And I also would like to thank Nursing Management Department staff, 4th year BSc Nursing coordinators, and 4th year BSc Nursing students for being the organizers of this seminar and making it a grand success. I also thank our delegates for being a part of this seminar. I thank the members of V4 Media for evincing interest on covering the event. Once again, I thank you all for your attention. Thank you, one and all.
Thank you, ma'am, for delivering the vote of thanks. As we now come to the end of the formal function, I request the dignitaries to occupy their chairs of the dais. I request Ms. Anaswara to escort the dignitaries. We will shortly begin with the sessions. Over to Mrs. Frida D'Souza. Sing. All the delegates are requested to have their seats.
Good morning, everyone. I cannot hear the energetic good morning from you all. Good morning, everyone. Awesome. Very nice. Very nice. So, today, why are we all over here? Seminar. Every day you are having seminar. Today, what is the special seminar? Yes? Yes? Quality in healthcare or quality indicators in healthcare. So today we have all come together to look into the aspect of quality in healthcare, particularly healthcare. So let's swim, float, relax in the ocean of quality and get back after 2 hours. Yes? Are we all ready? Yes. So there are few things before I start my seminar. I'll be moving. Before I start my seminar, I want to tell you all the best 2 things about the organization. One, 9:15 a.m. sharp, the inauguration was started. What does that mean? Punctuality. When you say punctuality, what does that again mean? What do you understand with punctuality? Honesty, sincerity, time bound, yes. But at the same time, what about the quality of time that you all are maintaining? Yes? 9:15 sharp, the inauguration was started. Next important point that I noticed, the sampling that was given to the dignitaries on the days, let it be Dr. Sorake and Mr. Khalid, Administrative Officer, and myself. All the 3 samplings were of the same size, same flower that has come out, and everything uniform. What does that mean? What does that mean? Again, no differentiation, no hierarchy. It means equality, which is equal to quality outcome. Yes? It was a very good gesture. These are the 2 points which I noticed during the inauguration. So nothing but it adds on to the quality of the organization. So heads off to you all and a great job done by you all. And thank you for inviting me as the speaker for this seminar. So getting into the topic of quality, today we are going to go floating. Yes. I will not have any fancy slides over there, no cartoon slides. It's more of theoretical with lot of knowledge sharing and examples. Everyone have gone to the hospital for exposure? Yes, at least a week you all have been posted in the hospital? Yes, all are very happy, yes. I'm sure you will be posted more in future. At the same time, there are lot of things in the hospital which we need to improvise, which we need to maintain, and which we probably in future need to upgrade. Yes, when I say upgrade in the hospital is equal to quality as well as IT, technological. We have seen IT people working in big buildings in the system and using completely the software. But in the healthcare, we are still in the documentation, we are still in the manual writing. System entry is very minimal. But as years go by, even healthcare will go into completely system. Is there a hospital in our country which is completely paperless? Any guesses? Is there a hospital in our country where the pharmacy is completely IT controlled? You will see only one person in pharmacy and everything is IT control. Basically robotic. Yes? Is there? Not there? Yes, it is there. In Hyderabad, group of care hospitals is completely paperless. How many of you are from Kerala? Then you should be very proud about your state and your hospital in the state. Aster at Cochin is completely IT technology pharmacy it is having, the one and only one pharmacy in our entire country. So these are the innovations, these are the upgradation in our country, ultimately leading to quality and betterment of care. Yes, so today's main topic is quality beyond accreditation. Is quality everything? Is accreditation necessary? Is certification everything for the hospital? Or is there something beyond accreditation and certification? Yes. Next, we are going to see into the patient safety goals. And then we are going more into NABH. Have you all heard about NABH? Yes. In the hospital, whenever you were having your postings, you must have heard about NABH hospital, NABH. Yes? What is this NABH? Very good. National Accreditation. Mute mode. We will go into the topic later. Yes, this is nothing but it is an accreditation. Then after that, last topic is to understand the process and to improvise, we have something called as indicators. So all this thing in the gist, we are going to speak for 2 hours. Okay? Getting into the next slide. Favorite question. Ayyo, again same question. What is quality? So what is quality according to you all? What is quality? I know no one will answer, so I'm coming to you all. Yes. Your good name?
Preeti, ma'am. Preeti.
Preeti. So Preeti, can you tell me why did you choose this dress today? Or why did you choose this dress from the store? Not today, from the store.
I like, ma'am.
You liked it, so you chose. Okay. Any other thing specific? Color, material?
I like this material. I like this color.
Okay, so I can't give you the extreme examples of the hospital because you are still about to go into the hospital examples. So I'll give you the examples as per your right now present situation. So why did she choose that salwar from the store? Because she liked the color. Next, what did she say? I like the material. What does that mean? Is equal to quality. Okay, so whenever everybody over here are wearing something very special today. I can see many of them in saris and well dressed today. So basically every day you're well dressed, but today I'm seeing many of them in saris over here. Why? Why? So there is something special. That something special in healthcare is nothing but quality. If we want to provide utmost care to our patients and our customers, we need to provide quality service. That is quality. That extra effort, extra dedication comes with quality in healthcare. Yes? Now various definitions. You can take any definition when you're going home. Quality is nothing but conformance to requirements. Quality is nothing but seeing that the standards are met. Quality is nothing but doing the right thing at the right time, even when no one is monitoring. Example, I'm writing my exam. There is no CC camera in the hall. And then teacher will say, okay, students, you have to finish your class, your exam in next 20 minutes. I'll just go out and I'll come. By then, what will happen? Endo, ado answer endo. What is that answer? What is that answer? Just tell me that answer. 1A, 1B. Yes, that is not quality. Quality is doing the right thing at the right time when no one is observing or monitoring us. Yes, most of the time in the hospital, 9 o'clock to 4:30, chaka-chak, everything will be fine. There will be supervisors, there will be administrators, everybody will be around monitoring, everything will be fine. Hand wash, writing notes, communication with the patient. After 5 o'clock to morning 9 o'clock, you have to check the quality. If the quality is the same, just like 9 to 5 o'clock, that means your hospital has grown beyond supervision, is walking in the footsteps of quality. Got it? That is what today's seminar is talking about. It's not about accreditation, it's not about certification. It's about beyond that, what are we doing? That is quality. Got it? So various definitions are there. Any definitions you can take up. The slides are given with the students. You can collect the slides later. So now, coming to the another main terminologies. We must have heard that hospital is NABH accredited. This hospital is ISO certified. Okay, hospital, no. Have you all seen your kurkure or some biscuit packets behind? What is written hallmark over there? Don't tell me ITC, that is a company. Which is the hallmark? Quality hallmark? ISO? Yes, FDA is there. Food and all FDA is there, but most of the thing will have ISO. The pipes, some other items, okay, wear materials, ISO it is written. So what is this ISO and what is this? ISO is nothing but it's a certification. What is the certification and what is this accreditation? What is the difference? Difference is nothing but ISO focuses mainly on providing certification to the organization. It can be hospital, it can be industry, it can be factory. And it is giving certification to particular process or particular item, not to the entire factory. Got it? Whereas when we speak about NABH to the hospital, accreditation, the audit is done by a third party and this is for the entire hospital. Tomorrow when the NABH assessment happens in the hospital, we cannot say the assessors, please don't come to emergency. Emergency is not required for NABH. No. Right from the security to ICU, OT, emergency ward, IP, non-clinical areas, everything will be assessed. That is called as accreditation. Whereas ISO, when you speak, it assesses a component. It can be the maintenance department. It can be the documentation in the hospital. It assesses a particular component only. Got it? So accreditation and certification. So any doubt in accreditation and certification? Any doubt? When we speak about accreditation, it is the entire hospital. When we speak about ISO, it is a component of the hospital. Got it? It is not for the entire hospital. Why? We will see in the ISO slide in the further slides, okay? During the further slides. Now, let us go into, is accreditation mandatory or voluntary? It is very much visible there. So, why do we say accreditation is voluntary? Why? Accreditation or certification, why is it voluntary? Does all the hospital in Mangalore is NABH accredited? No, absolutely not. Yet, we all are functioning. Many of the hospitals are functioning without being accredited. At the same time, the first point, healthcare license. Is it mandatory? Yes. Without the license, I can't start my hospital. Coming to the college building, without the license, I can't build a building. Yes, there should be a trade license. Then there should be a license from the municipality. Then starts other things for the college building. Whereas hospital, KPME certificate is a must, followed by remaining things. Yes, license is mandatory, whereas accreditation, certification is all voluntary. If you want, you can go ahead. If you don't want, don't want. But remember, accreditation or certification, both are like a stamp to the organization's name. It's just like I can buy a laptop of Dell or HP, or I can buy the laptop from Apple. What is the difference? What is the difference? Any difference is there? Okay, laptop not required. Example, mobile. I will buy a mobile of Vivo, Redmi, Apple, Samsung. Any difference is there? Yes. So what's the difference? Quality and price. You're correct. Same way over here. When we have accreditation to the hospital, the quality of the service, quality of the hospital also improves. It doesn't mean without accreditation there is no quality. Why? What about Redmi, Vivo? Those are also phones. Don't they serve the purpose? Yes. Don't they have WhatsApp? Yes. You can talk, you can message? Yes. You can browse? Yes. Then why Apple? Apple is Apple, madam. Yes. Exactly. Okay. NABH is NABH. Got my answer? Yes. I'm sure many of you have seen this signs in many of the hospitals. Yes? Correct? It can be NABL, NABH, NABL blood bank, or NABH emergency medicine, eye care NABH. Variety are there. JCI is also there. JCI is not much used in our country. JCI focuses mainly on tourism. Joint Commission International focuses mainly on tourism. It is also an accreditation which is highly appreciated if you have foreign patients. Clear? In Mangalore, no hospitals are JCI. In Kerala, many of the hospitals are JCI. Rajagiri Hospital, then lot more are there. Okay, KIMS. So all these are JCI. And Apollo is JCI. Yes, entire group of Apollo is JCI. In our country, we are mainly with NABH. Clear? We are mainly with NABH. Yes? Is it going too much? Or are you all with me? You are able to understand, right? Yes? Yes. Next thing. What is ISO? ISO certification is mainly, now we are talking only for the hospital and healthcare. We are not talking about factories and industries. So what does ISO mainly focus on? What is ISO? International Organization for Standardization. Correct? All, many of you wrote pretest, no? Array, not correct. Correct? Okay. So, International Organization for Standardization. It is nothing but, it is a certification given to the organization, whoever is following particular process to particular systems. In organization, each departments, you can term it as system. In each department, there are processes. So when you're following them, if you're going into ISO certification, then you happen to clear all their NCs, you get ISO. Clear? Presently, there are 3 types in ISO. Applicable to the hospital, applicable to the hospital. If we are talking to the industry point of view, there are 6 types of ISO certifications. Now again, we will come back to hospital only. In hospital, 9001-2015. 9001 is to 2015 mainly deals with quality management system. Quality management system. Remember, ISO is mainly focused on documentation. Next is 14001. 14001 mainly deals with environment management system. When we speak about environment, it is part of the hospital, but not within the hospital. Now, if I have to give you more example, 14001, what it does, it is mainly, I'll tell you the process, okay, of 14001. 14001 focuses mainly on the environment. So when it focuses mainly on the environment, it goes and sees how are we discarding our biomedical waste. Why? Biomedical waste is directly imparted to the environment. If at all the biomedical waste is not segregated properly, what happens in the environment? Yawning. I'll make you all dance now. In 5-10 minutes, if more yawning takes place. Yes, so environment-friendly biomedical waste. Air pollution. If the waste is not segregated properly, there can be air pollutions. Why? The microorganisms will fly in the air if it is not wrapped properly. Soil pollution. If the waste is not dumped or incinerated properly, it leads into soil pollution. Ultimately, what happens to the environment and the people? What happens? Our health will get spoiled. It can be because of the contaminated water. It can be because of the contaminated soil where the fruits or plants are being planted. Yes, ultimately it is, that's why I told you, I'll speak about the chain. We humans throw the waste into the environment will give us back, and we land up in hospital. Okay, so in order to prevent that damage to the environment by the hospital, again, I'm talking about by the hospital, 14001 ISO focuses mainly on audits with regard to biomedical waste. Clear? Yes. Next we have 50001. This 50001 focuses mainly on energy management system. What is this energy management system? Energy management system is nothing but how are we taking the energy? That is light, fan. Do we do rainwater harvesting in our hospital? Are we having LEDs? Or are we having solar panels? How are we doing? Green energy. Nowadays, everyone must have heard, no? Green energy hospital, green energy homes. Have you all heard that nowadays the homes are built by using bamboo? Our ancestors used to build the house using bamboos. Yes, everyone agree? Yes? Now again, the architects have started using bamboos for building the buildings. Why? Energy efficiency. It is termed as energy efficiency building. Similarly, even in the hospital, they are coming up with the energy efficient buildings. Green hospital, green OT concept. That particular concept comes under 50001 ISO. Okay? From now on, you will be little more familiarized. This is nothing but patient safety goals. So why are we talking about patient safety goals? Till now, we have seen what is quality, what is accreditation, what is certification, and the different types of accreditations and certifications. We are not going to talk about all the accreditations and certifications. We are going to talk only about NABH in the upcoming slides. before going to NABH, let us first see patient safety. What do you mean by patient safety in the hospital? Okay, let me put up another question. For having the safety for the patients in the hospital, what are the things required in the hospital for a patient to be safe? Think. All had your postings. You must have carried the patient in a wheelchair, on a stretcher. Yes, you must have shifted a patient to OT or OPD. Think. How was the patient safe on a wheelchair or on a trolley? I can hear something. Superb. Again, very good answers. Side rails for the trolley. What about the wheelchair? Is there something? What is it called? Car, what do you call? Seat belt. Similarly, there is a belt for the wheelchair also. And there is strap even in the trolley along with the side rails. Why are you putting all this? Patient will jump forward. No, patient won't jump. Then why are you putting this all? Yes, in order to increase the safety of the patient. Yes, this is one example. Give me more examples for the safe environment in the hospital. Side rails finished. Stretcher belts over. Anything else for the safety of the patient? More examples. What about the washroom? Okay. Have you all seen the washrooms in the hospital? Yes. Do they have something called as a grab bar? When the patient is sitting in the toilet, standing, there is a rod-like thing for the patient to hold and get up? Yes? Next posting, everyone will go to the bathroom and check. That is the patient's bathroom, not the staff bathroom. Okay? There is something called as grab bar. And what about the toilet's flooring? Is this like this silky? Rough. It is called as anti-skid flooring. If we put this floor in the bathroom, our one patient will become 4 patients. Hospital is very happy anyways. So, that is the flooring over there used is called as anti-skid flooring. Yes? What about one more important? Nurses are sitting in the nurses station. Patient is in the single room. How will the patient tell you, I'm having pain, come? Yes. Indicator is correct. Call bell. Yes. So there is something called as call bell. So what are all this in the hospital? Nothing but safety parameters. Got it? These are the things which are important to prevent further damages in the hospital for the patient. Okay? Now, with regard to the same, we are going to see the patient safety goals. Clear? There are various safety goals as per International Patient Safety given under JCI. So, we will see one by one. What is patient safety? As the first slide said, it is not merely the responsibility of the hospital. It is also the responsibility of the patient. Why? We admit the patient in the single room and put in the entire hospital no smoking zone, no smoking hospital premises. Evening 7 o'clock, come near the tea shop outside. You will see your single patient standing there and what is this? That is why it is called, it is a partnership. It is not hospital and the employees alone responsibility for the patient to be safe. It is also patient's responsibility to see that when he is in the hospital, he follows the rules and regulations. Right? Agree? Then, what is patient safety? Patient safety basically comprises of actions undertaken by the individuals and the organization to protect the recipients from further harmful things in the environment in the hospital. Okay? Basically, patient safety speaks about safe environment. Not only to the patient, but also for the healthcare professionals. Got it? Don't think that NABH is only for the patient. No. It is also for all of us. Clear? All the healthcare professionals who are working in the hospital. So definition is clear? Anybody will be able to tell me the translation of that? Latin. Primum non nocere. What does that mean? Nothing but do no harm. Do no harm. Patient safety's main focus is do no harm. The patient has come to us to the hospital. We should not do further harm to the patient. That is why the patient safety goals have come up in the year 2001. Got it? Earlier there was no patient safety goals. Something someone used to do. From 2001, the patient safety goals have come into the picture. So, basically, 2002 implemented by JCI. And what does it actually do? Basically, patient safety goals, we need to follow them, as well as in case there are deviations. In case there are deviations from what is expected, it has to be reported. Clear? Reporting is very important. We will talk about it in the further slides. And patient safety helps the organization to achieve the accreditation as well as maintain the accreditation. Clear? So this is another. The various patient safety goals in the hospital. This is very important, not only for the nursing students as well as nurses and also non-clinical staffs. Everybody, doctors, everybody, this is very important to know. Why? This is the base of many of the problems caused in the hospital, from the hospital to the patient. Yes? Identify patient correctly, improve staff communication, use medication safely, use alarm safely, prevent infection, identify patient safety risk and prevent mistakes in surgery. Yes, one by one we will see. Don't worry, everything won't go into the brain all of a sudden, but I will be happy, the teachers over here will be happy if you are able to understand there is something called as patient safety goals. Okay, so same thing in the pictorial representation. The various patient safety goals, 6 patient safety goals in the pictorial representation. Now coming to the patient safety goal 1. How many are from Mangalore here? Mangalore Catholics? Yes? Come forward. Come forward. At least 5 of you come. You know the bylaw? Come. There is no state differentiation. Don't feel bad. Nothing, no state differentiation. They are going to dance to you all. Then you will follow the dance. Yes? Ready? You know the dance, right? 1, 2, 3, 4, 5, 6, 7, 8. You know, right? You all know, right? Yes. First, everyone will observe them. Then all of us will do it together. Yes? 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Ready? Ha 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 ha. Ready? Yes. Let's begin. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Yes, all have got up. Thank you. Now I can hear them now. Yeah. Good to hear you all talking and murmuring. Till now all were like stuck and many of you were yawning. Yes? It's okay. It's normal. When we were of your age and if somebody would have come for the quality, it becomes a little tedious or little effort-making session. But at the same time, as years go by, you will love this session. Okay? So now, getting back onto this. Shall we? Otherwise, more and more activities will be put inside. Don't yawn so that you want more activities. Yes, patient safety goals. Goal number 1. Identify patient correctly. Let me hear from you all. How do you identify your patient correctly in the hospital? 4th years, 3rd years, 2nd year. How do you identify the patients correctly in your hospital? By their very good name. Okay. Now there are three patients. Patient number 1 is Meena. Patient number 2 is Meena. Patient number 3 is Meena. 26 years, 26 years, 26 years. Very good. ID number, that is called as UHID. Unique Hospital Identification Number. In the hospital, it is called as UHID. Got it? So good, you all know the answer. So the first goal is already met. Yes? Yes. So, basically, 2 identifiers. 1, the patient name. 2nd, UHID number. Yes? If not, some of the organizations have kept date of birth or address or mobile number. Yes, anything as per your SOP, as per the hospital protocol, you can follow. But accepted protocol will be name with UHID. Got it? This is how we identify our patients. Don't identify only with one identifier. No, there should be a second identifier. Okay? Next, patient safety goal. Improve effective communication. I want the answer from you all. How do you improve the communication? How? Okay. Gumpinalli Govinda. So let's give the mic to one person. No one is looking at me. No one is looking at me. Yes. How do you improve the communication?
To communicate with the patient.
By?
Communicating with the patient.
Yeah. Good. Sit. Next, by communicating to the patient, I improve my communication. Absolutely, because I can't stand numb. If I stand numb, the patient also won't understand for what you are standing. You will also not know how to proceed. Now, communication. How are you doing the communication?
with the diagnosis. Ask a question.
How do you communicate to the patients?
To communicate the diagnosis. What happened?
Okay. What are the factors that you're keeping in the mind while communicating to the patient? Smile, huh? Good, good. She only smiled. I will take that as an answer because smile is also one of the greatest communication method. But at the same time, I was expecting language. Language is very important when you communicate to the patient. It can be Tulu, it can be Hindi, it can be Malayalam, it can be Kannada. Language, mode of communication is also very important. And one more important factor, expression of communication. Yes? Sir, ನಿಮ್ಮ ಪೇಷಂಟಿಗೆ ಓಟಿಗೆ ಕರ್ಕೊಂಡು ಹೋಗ್ಬೇಕಂತೆ, ನಾಳೆ 9 ಗಂಟೆಗೆ ಓಟಿ ಅಂತೆ, ರೆಡಿ ಆಗಿ ಆಯ್ತಾ? With that expression only, what will the patient say? ಓಟಿಯಾ, ಅಯ್ಯೋ. Yes? At the same time, if you happen to do the communication with the proper expression, sir, ನಾಳೆ ನಿಮ್ಮ ಪೇಷಂಟಿಗೆ 9 ಗಂಟೆಗೆ ಓಟಿ, ಇವತ್ತು ಅವರು ರಾತ್ರಿಯಿಂದ ಊಟ ಮಾಡಬಾರ್ದು, ರೆಡಿ ಇರಕ್ಕೆ ನಮ್ಮ ಸಿಸ್ಟರ್ಸ್ ಅವರು ಬರ್ತಾರೆ, ಡಾಕ್ಟರ್ಸ್ ಬರ್ತಾರೆ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡೋಕ್ಕೆ. ಸೊ ಹೌ ಇಸ್ ದ ಕಮ್ಯುನಿಕೇಶನ್? Yes, with the communication itself there is lot of difference. The impact depends on the communication. Clear? Over here, same thing. I gave you example of OT. Accurate information, critical information. The way we communicate matters a lot. Okay? Once in emergency, one of the emergencies, patient was gasping and they had the music system in that emergency. So FM used to play every time. And the patient came in gasping and they had to intubate the patient. And at the same time, a song from FM plays. Jile, that Munnabai MBBS, that one song is there, full dung, 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 dung song. There the patient is critical. Bystanders are all tensed. And the song that is playing is like one dancing music number. Is that appropriate? Absolutely no. The environment also should be supporting when you communicate. Why I am telling you this? In ICU, there are critical patients. There are patients who might come out of their criticality, who might deteriorate. If we happen to go and inform that to the bystander in front of all other bystanders, what will happen? That is why in many of the hospital as well as NAPH has put up this particular clause that every ICU critical area should have a very good counseling room. Somebody has done the full use of the posting. Very good observation. Counseling room. Yes, that is how you communicate. Right? Communication. Next, have you heard about verbal orders? Is the term verbal orders familiar to you all? Yes. Don't worry. You can tell me what you know. Based on that, I will add on. Faculty? No. Only students. Yes. Anybody from the team. Verbal orders. Does anyone know? Lift the hand. Any idea? Lift the hand. Otherwise, it's okay. Okay. Verbal orders. Faculty will support. Please.
Ma'am, we'll be receiving the orders through call. So when we are receiving the orders through call, we should make sure we should listen it properly, and we also repeat the same thing, whatever the doctor said, so that misunderstanding will be prevented.
Very good. Yes. So Madam said very rightly, verbal orders is nothing but most of the hospitals, every time doctor won't be next to the patient in ICU. Yes, doctor won't be next to the patient in ICU. So suddenly patient is deteriorating or blood parameters are going up and down or GRBS is very high. Want to start insulin? Yes, you communicate the report to the doctor. Doctor from somewhere else will tell you, sister, please start injection insulin 4 units, 10 units or start on the drip. However, injection insulin 4 units stat. So what will the nurse do from the other side? Nurse will tell, doctor, did you say injection insulin 4 units? INJINSULIN 4 units. You will repeat not only the order, you will spell the drug also. Okay, that is called as verbal orders. Once that is done, yes sister, that is how it is. Over, document in your nurse's notes about this. Next visit when the doctor comes, he has to write it in his medication order. Got it? That is the closure of the verbal orders. But verbal orders, basically, doctor will give you the order in the phone. You will repeat the order, you will spell the drug, and then you will document. Give to the patient and document. Yes, that is called as verbal orders. Next, goal 3. Improve the safety of high alert medications. Now, pharmacology is in second year, right? Second year. So, have you all come across some of the high-risk drugs? Can you all name me one drug, one high-risk drug, which we should not give to the patient without the orders at all, first of all, and if given, we should monitor the patient. Calcium gluconate, adrenaline, potassium chloride. Yes, these are all high-risk drugs. So in situation of high-risk drug, what are we supposed to do in the hospital? What is the nursing team, pharmacy team, doctor's team supposed to do? So all the high-risk drugs has to be colored red. Now that doesn't mean you will take each drug and start painting. No, you get the small stickers in red. You have to stick the red color sticker on all high-risk drug packs and keep it aside in the separate drug, okay, separate row. And the rights of the drug. What are the medication rights? Okay. Now I'll pass on the mic. Now all are looking at me.
Right patient, right time, right dose, right medication, right refuse medication, right documentation, right frequency.
Did she cover everything? Yes, almost, yes. So, the rights of the patient. So, I caught you all. When you know the answer, all of you will be looking down or looking at that side, not at me. And when you don't know the answer. And when you know the answer, all are looking at me. Yes? So I got the clue from you all. So basically, not only with regard to high-risk medication, any drug before giving, we should see that right patient, right dose, right frequency, right route, right time, right administration, everything has to be seen with the right documentation. Yes. Got it? Yes. The fourth goal, ensure correct site, correct procedure, correct patient surgery. How many of you have got OT posting? I have already finished. OT posting. No one is lifting the hand. Third years? No? Okay, no problem. So, in the OT, this is used. The fourth goal is used as a patient safety goal in the OT. So what does this goal mean? There is a WHO surgical safety checklist. Remember, WHO surgical safety checklist. So what does this checklist tell? This checklist, before operating on the patient, the doctor has to do the sign-in. There is 3 columns. It's like a A4 sheet divided into 3 columns. Okay? In the first column is sign-in. Sign-in is nothing but pre-op check. What is your name? Yes, correct. Age? Correct. So what is your problem? I have a right femur fracture. Yeah, correct. Then there comes the site marking. Why? Femur fracture can be even in the left. If you don't write right, the patient will be operated on left and come out. Okay, let me talk an example. Which is that famous personality whose mother had to go X mark? Got it? So sign in. Then time out before skin incision. Who does this? This is done by the surgeon. Okay? The first one is done by the anesthetist before giving the anesthesia. The second check is done by the surgeon before doing an excision or cut on the patient, checking on the site mark, checking on the mark, checking on the case file, checking on the patient. In OT, not all the patients will tell you, I am Basappa. Sometimes his name. Not all the patients will tell their name in OT. So, sometimes you have to see their hand. They will write here. Very good, very good. ID band. This is another identifier. Yes, all of you have seen the ID bands in the patient, right? That has to be there on the patient whenever the patient is going to OT. Okay, so check that, check the patient case sheet, check again the time in protocol check, and then after that the surgeon will do time out. Then what happens in OT? Surgery takes place. Once the surgery takes place, the last one, sign out, is done by the nurse. Why? Before the closure, the nurse has to check the total number of gauze pieces, the pads, everything. So, if at all anything is left inside the body, the pre-check and the post-check has to be equal. If it is not equal, what does that mean? Gauze piece is either inside or in the dustbin. Okay, both can be possible. So we need to check. Now another brainstorming. They didn't get the gauze piece anywhere. Not even in the dustbin. Gauze piece, no, it's like a small pad-like thing in the OT. They didn't get it anywhere. How sure are the doctors and the nursing team that the gauze pack is inside the patient? Anybody from the team? How sure are you that the gauze piece is inside the patient? No, I'll come to you last. First here. You didn't get the gauze piece anywhere, but you are not sure whether it is inside the body. But you can't take a risk of shifting the patient out. So what will you do? Superb, superb. Which year students are you? We take an X-ray immediately in the OT. What X-ray does? What will the X-ray do? Every gauze piece has got a radio opaque line in it. If it is left inside the body, when taking the X-ray, gauze can be seen. Got it? It will shine. The line will shine. Got it? Only after that, if not there, then we can shift out the patient. Available immediately, re-exploration takes place, surgery will be done and taken out again. Clear? Some new learning to few people? Yes? No? Yes? Yes. So safe surgical checklist is used mainly only in the OT, operation theatre. Clear? Next goal, reduce the risk of healthcare associated infection. How will you reduce? Now all are afraid to answer. Why? Next question will be? Okay. Okay, correct answer. Tell me. Hand wash. Brilliant, brilliant. After COVID-19, hand wash and face mask has come into the picture widely. Right now, face mask is again going out. Unless some 10 people of us will start, then dupatta will come or face mask only will come. Otherwise, now face mask is almost out. But at the same time, hand hygiene, hand washing compliance is improved a lot in the hospital. Actually, now, so let's go into the demonstration of hand wash. Anybody from the group? Hand wash technique. Actually, this is not part of my topic, but if I don't take this, all are, it's, okay, come. Hand wash technique, come. Yeah, you can think. Think for a minute. They know. I can actually see your teachers being very confident. And your teacher is also telling that they know, madam. Yes, one confident student or in the process of confidence, please come over here. Yeah, you can demonstrate. You want the mic? Not in order, but no problem. I'm there. I'm there with you.
Palm to palm, back of the hands, knuckles, interlocking, fingertips, thumbs, and wrists.
Yes. So what she did is absolutely correct. She covered all the steps. Palm to palm. Okay, hand to back palm. Then is interlacing. Then is interlocking. Then is thumb. Then is fingertips. And then is. Very good, very good. What's your name? Kripa. Kripa. Give a clap again to Kripa. Good. That's a wonderful demonstration what she has done. At the same time, it is very important. It's not for the steps that we do. 1, 2, 3, 4, over. No. And don't do it because your teachers are seeing. Don't do it because your supervisor in future will be seeing you. There will be audits done every day. Hand hygiene audit will be there, done by the HIC nurse team. Don't do because they are seeing. Do it for yourself and for your family. And for the patient, of course, it is for the patient also, but do it for yourself and for your family so that you, when you are working in the hospital bedside, you don't carry organisms back home. Yes? Correct? Do it for yourself. Why? So that you are healthy and you can take care of all the people in and around you. And do it for the patient. Why? One smiling patient recovers and goes out of the hospital with your beautiful hands, care and love and affection will bring in 10 more patients to the hospital. Because they will say, nurses are very good over there. Have you heard patients telling, doctors are very good. I only come here only for the doctor. And some hospital nurses are very good. Doctors are not there also, no problem. Nurses are there. Yes? So that is how it is. So take care of the health of you, your family, and your patient. Clear? Hand hygiene. Cartoon Network or organisms are. Yes. And how do you do this? Is by hand wash. Where is the steps demonstrated of hand wash? There is something called as HIC manual. There is something called as Hospital Infection Control Manual. In every hospital it is there. You go to SCS, you go to anywhere, it will be there. 100%. Okay, it is written. All the HIC protocols are written in that manual. We will speak about this manual and HIC in the 5th chapter of NABH, second half of the program, okay? Patient safety goal, the last patient safety goal. Reduce the risk of patient harm resulting from falls. Have you seen a patient falling in front of you? Or have you heard a patient falling in the hospital? Yes, there are two types of fall. One, it can be because of patient's condition. I have giddiness, I have syncope, and I fell down. Yes? Two, which is the second? Healthcare professionals induced fall. What does that mean? Water kept on the floor, not mopped. Patient came, slipped. There is no caution board. Patient didn't know, slipped. There is no anti-skid flooring in the bathroom. Patient wore his house slippers, Bata 100 rupees slippers. If you take, for sure you will fall. Okay? So that is guaranteed. Nowadays it's okay, but earlier times that Bata slippers used to come, you remember? Our parents, grandparents wearing them. For sure. After 1 month, definite, because the bottom will go off and you will fall. So, basically, it's the hospital-induced falls. Clear? How are we preventing is all on us in the hospital. It can be the administrators, it can be even the nursing team, it can be even the housekeeping team. Clear? If I have to talk more about it, there is something called as fall risk assessment score sheet. If you go to the hospital tomorrow, open the case sheet. Every case sheet has got a fall risk assessment. Just see, okay? Go tomorrow and see. There is a pressure sore assessment, fall risk assessment. Just see the score sheet, you will get a better idea. Tomorrow, everybody's homework. Tomorrow is okay. Whoever are going tomorrow for the posting, just check. Clear? This we already spoke, but in the pictorial representation, patient safety devices, safe transportation, physical handling, nurses call bell. Oh, we forgot to mention about patient safety, disabled toilet. Have you heard about disabled toilet? Yes? Yes. What does that toilet do, or what does that toilet have, or how does that toilet look? Have you seen a physical disabled toilet in the hospital? Okay. Tomorrow, when you're going for the posting, you will see that also. Got it? At the same time, every hospital has got a physical disabled toilet. What does this toilet do? It is not having this much of space. It is having an entrance of this much. Why? So that the wheelchair can go inside. Yes? And it doesn't have a slab. Every toilet before entering has a slab, right? So the water doesn't fall. This doesn't have a slab. So the wheelchair goes straight inside the toilet. And disabled toilets have got lot of grab bars. So the patient can hold the grab bar and sit in the toilet. Clear? Next. Is there something called as patient education in the hospital? Who does that? Nurses, doctors, What about patient care coordinators? Every floor there is a supervisor. Yes? Do they do the education? Nodi sir, ನಿಮ್ಮ ಬೆಡ್ ನಂಬರ್ 5. ಟಾಯ್ಲೆಟ್ ಲೆಫ್ಟ್ ಸೈಡಲ್ಲಿದೆ. ಕುಡಿಯುವ ನೀರು ಹೊರಗಡೆ ಇದೆ. ಮೆಡಿಸಿನ್ ಬೇಕಾದರೆ ಗ್ರೌಂಡ್ ಫ್ಲೋರಲ್ಲಿದೆ. ಕ್ಯಾಂಟೀನ್ ಬೇಕಾದರೆ ಫಸ್ಟ್ ಫ್ಲೋರಲ್ಲಿದೆ. Who tells this? Yes, sometimes nurses and sometimes patient care coordinators. Yes, every hospital has got each floor they will have patient care coordinators. So, educate the patient. It is very important to educate the patient. Otherwise, for patient, hospital is not daily place. It is something new. They will be confused. If you don't educate the patient when the patient comes to the ward, what will happen? Every 5 minutes once, call bell will ring. Sister, sister, sister. By then you will be like, okay. So it's very important to educate the patient at the time of admission so that it's clear. Done? Next, informed consent. I'll go fast with it. Informed consent is mainly taken by the doctors. Remember, no nurses should take the consent from the patient. Tomorrow in the court of law, no nurse will be held responsible. It's only the doctor. And the consent only has to be taken by the doctors. Got it? Even counseling for the surgery has to be done only by the doctors. I am re-emphasizing because in another 2 years, when you go to the bedside as staff nurse, remember this. Consent is not to be taken from the nurses. It is only the doctors because they are doing the surgery. Got it? So that is one thing. Safety instructions. What are the various safety instructions that you all have seen in your posting? Safety instructions in the hospital. Hand wash safety instruction, okay.
Wearing mask.
Instructions. See, your friend is helping, is correct?
Fire exit.
Yes. One of the safety instruction is nothing but the fire exit. Have you seen it? Yes, fire exit instructions. Then there are many more safety instructions. Floor is slippery, don't go, and no smoking. You are under videography is prohibited. See, you are under CC monitoring. What are all those? Nothing but instructions. Got it? In the hospital, we have so many instructions. Clear? Something happened there. The screen is, okay. Okay, so what is our role in patient safety? Basically, when we say our role as an administrator, as the healthcare direct providers, what is our role? To provide a safe environment along with continuous quality improvement. What is this continuous quality improvement? We will speak about this in PSQ later, okay? At the same time, very important. I told you one manual some time back. Which manual I spoke? I told we'll speak about it later. Which manual? Very good. HIC manual. This is just one manual. Okay, I don't want to scare you all, but like that, we have almost 80 to 90 manuals in the hospital. And it depends on the total number of facilities that you have. Why? Cardiology, separate manual. Emergency, separate manual. Each department has got manual. Nursing department manual, HIC manual, PSQ manual. So many manuals. So there are so many protocols, policies, procedures written in the manual. It's not that every manual you should know or we should know. There are few manuals which we have to know and content has to be known, right? We have to be familiarized with the manual. So nothing but policies and protocols relevant to your department. Got it? Very important point. So this is again the same thing, patient safety. How do you build up? By keeping updated manuals, SOP, safety environment, side rails, grab bars, and all this thing, emergency code, all this we have to follow, okay? We'll take a break for this and we'll come back to the emergency codes because this is something important for every step and every day for you. Is it okay or we want to continue? No, okay, come back. We'll have one more interactive session. Yes, break for? Only 15, 1-5, not 50, 1-5. Yes, thank you.
We have come to the end of the first session. There will be a break for 15 minutes. Delegates are requested to go outside for refreshments. Thank you. The delegates are requested to remain seated. All the delegates are requested to assemble inside the hall. I repeat, all the delegates are requested to assemble inside the hall. Thank you.
Welcome back. Thank you. Yes, yes, yes. So another 1 hour of Zabardast session on NABH will be there. So I'm sure you are boosted with lot of tea, snacks, coffee, juice. Yeah, ma'am. Yes. So let's begin. Yes. Till now, in the last 1 hour, we have seen about various quality definitions, accreditation, certification, patient safety goals. Now we are going into emergency codes, few of the quality tools, and into NABH. Okay, let me tell you, NABH has got 10 chapters. That 10 chapters is a 3-day training. Are you? Okay, listening only he will. Okay, so NABH has got 10 chapters and that itself the training is 3 days. But we have to comprise and finish it in half an hour to 45 minutes. Clear? More of write-up is there, less of pictorial representation. But you are free to stop me anytime and ask question. Okay? Let's begin. Now I will ask question. Yes. So what are the different types of codes that you all know? Code, C-O-D-E, codes in the hospital.
SOS, that medication code.
That is, not talking, but it's in a medication order. Yeah. This is the hospital safety codes.
Code, that blue one, the red, the yellow one, black one, that for the needle, for white one, that the dustbins. Okay.
You have started with something and, okay, you, yes, anybody else? What are the various safety codes in the hospital? Code. Code blue, red, Dimaka Batti Chara. Yes, good, good. Appreciate it because it was there and once you start, everyone have started. That's how it is. You are with me. So now what does this mean, safety codes? Safety code is nothing but it is used in order to prevent the further damage in the hospital building for the patient or even the healthcare professional. So what are the various safety codes? Whenever the patient gets a sudden cardiac arrest in the hospital, the code that we call is code blue. And let me tell you, you go to US, you go to Australia, you go to Europe, you are in India. Code blue is code blue. Same color, same indication. Clear? Next is code red. What is this? Fire. In the recent past 2 years, we must have heard at least 4 to 5 hospitals catching fire, including AIIMS, Delhi. Yes, one of the wing. So what is the code that is used? Code red. What do people do when the code is called? They evacuate the building. How do they evacuate? There is mock drills being done for that. How to evacuate the building. So for fire, the code is code red. Then we have code pink. What is code pink? Name itself says. Pink means what it is? Baby. So it is nothing but baby abduction. Okay, baby is missing in the hospital. Immediately you have to alert the entire security, close the front entrance gate, everything, close the door, everything. The code that is used is code pink. Okay, next code, code purple. From here, what I'm trying to tell you is code blue, code red, code pink. These 3 codes are universal. Anywhere and everywhere, color remains the same for the disaster or the code. But from code purple, code yellow, code gray, code black, code brown, the colors can change. Today, you might have learned code purple as for violence. But tomorrow when you go to the hospital, it might be in that hospital code gray is for violence. it will differ from place to place. That is what I'm trying to tell you. So, take home message from this slide. Remember, code red, code blue, code pink is universal. Cardiac arrest, fire, baby abduction. Same color, same code. Yes, other colors will change. Clear? So these are various codes in the hospital. What do you mean by internal disaster and what do you mean by external disaster? One example, I'll move on. Which is an internal disaster? Any internal disaster? Internal, within the hospital, inside the hospital. And you have to evacuate the patients. Fire, but if it is exclusive fire, we call code red, okay? Short circuit, again we can call code red only. Building wall collapse, ceiling fell down. Yes, false ceiling, this is a false ceiling. After 5 years, this can fall. Every ICU has got a false ceiling. Clear? So, false ceiling falling, construction building falling, wall collapse, all this is internal disaster. Okay? Next, what is external disaster? Very good. Earthquake. Mangalore is prone for which disaster? Floods. Very good. Floods. Okay. So these are the various disasters and their codes used in the hospital. Now, what is PSG? What is PSG? I want it louder. Very good. Patient safety goals is nothing but PSG. What do you do? First, you need to have a policy or a SOP. Then after having a written policy, how are you maintaining a PSG in your hospital? Have a written policy. Conduct audits. Audits is nothing but it's like an inspection using the set criteria. Okay? Followed by observations. Incident. What is an incident? What is an incident? One example in the hospital. Okay, one example in your college. Incident example, incident. The videographer is having so much of work today. Yes. What is an incident? Incident. An event. Tell me one example in this room. If which are the incidents that can take place in this room? What is that? Dizziness. No. Incident that is physical. Incident is external, but has happened, but has caused damage to you. Ah, very good. Falling. Fan falling. Chair, this chair broke off, you sat, fell down. Yes? All these are nothing but incidents. Clear? Similarly, there are incidents that are happening even in the hospital. It can be short circuit, it can be fan broke, it can be patient fell down, it can be pressure sore. What is a pressure sore? Bed sore. Anything that was not supposed to happen but occurred is called an incident. Okay, one more brainstorming. Sentinel event. What is a sentinel event? Have you heard the term? Okay, sentinel event is nothing but whenever the incident happens in the hospital and it is treatable, curable, no much harm to the patient or the healthcare, it is an incident. Whereas, patient was walking on the floor, fell down, slipped, hit the head, big EDH, head injury, neurosurgery got a new case, operated, patient was supposed to discharge and go home that day, but was in the hospital for another 2 weeks because of this incident. This is nothing but sentinel event. Got it? Sentinel, S-E-N-T-I-V-E-L. Sentinel event is also an incident, but it is a major incident for the patient. Okay? Sometimes it can lead to death also. Death also. Then committee review. Let me not go into this, but what do you mean by committee review is, in the hospital there are various committees. Quality committee, safety committee, code blue committee, HIC committee, so many committees. Okay, so I'll not scare you right now. When you come into the hospital, you will get into that process. So, any occurrence, incident that takes place, deviations that take place from the protocol is discussed in the committees. Okay, and the action will be taken. Action means it's not punishment. There will be a change in the SOP, or there will be a question session, why, and then the need will be changed accordingly. Clear? So the gist of it, what we learned till now, how are you monitoring the patient safety goals and what are the goals? I'll skip this slide. This is one of the favorite quality tool used by any quality person anywhere in the hospital. It is called as Ishikawa model. Or how does it look to you all? All eat fish? All like fish? After eating fish, how does the bone look? Fish bone. So nothing but fish bone analysis. So you write your problem. Your problem is, exam is tomorrow. So what are the hindrances for the exam? You can divide into man, material, environment, personal, HR, friends, family, study leave, light, power, current, no notes, no textbook. That only is a big hindrance for exam tomorrow. Yes? So, what does the fishbone analysis do? The head of the fish, arrow mark, is the problem. What are the various factors contributing for your problem? You write it down. Yes, once you write it down, remember, for one problem, there might be 100 problems adding to that problem. But sometimes, in that, if you choose one or two to solve, it might lead to 80% of your problems being solved. Clear? So choose wisely that one or two problem which leads to that fall and accordingly act upon. Clear? So basically, again, let me give you fall. So various factors, environment, manpower, HR, process, various factors. What are the problem? There was no call bell. There was water on the floor. There was no caution board. There was no side rails for the patient. So patient jumped out of the bed and went by himself. Then environment factors. The floor was very slippery. There was no side grab bar. So what are the various factors for the fall? Jot it down and finally solve one or two problem. In that, remaining will automatically come into the picture. Okay, come down from the picture. Clear? That is called as fishbone analysis. Like this, we have, by the way, what is a quality tool? Quality tool is nothing but it helps the organization to understand the problem better. In every hospital, there are problems. Every hospital, there will be an issue. In order to solve the issue, we use different tools. That tool, one of the tools is fishbone analysis. With this, we are finishing the first session. Now we are going into the second session. I will cut down and come to 40-45 minutes. At the same time, remember, the upcoming slides are not very fancy. It is more of theory. And adding on to that, it is very important for everybody here Very important, because nowadays every hospital is NABH accredited. Tomorrow, if you are coming to our hospital with experience or without experience, the first question what we ask is, are you from a NABH accredited hospital? If so, your weightage will be more in terms of remuneration as well as in terms of posting. If not, accordingly we will see. So it's very important, at least know the basics, everybody. I'm not telling you to know everything. It took me 10 years and I'm still learning. Okay, so in 1 hour we will not be able to, but understand the basics. Clear? Total chapters in NABH, 10 chapters. Total standards, 100 standards. Inside each standard, there are multiple objective elements. How many are the objective elements? 683. And quality indicators are 32. This is as per NABH 5th edition. Presently, we are in NABH 5th edition. Clear with the outer look? Yes. Don't get confused. Chapters are nothing but your units. Okay? Chapters are nothing but in your syllabus you have no chapter 1, human anatomy, eyes, chapter 2, human anatomy, chest. So those are the chapters. What are the standards? Inside the eye, you will learn various conditions. Those are the standards. What is objective element? Inside those conditions, you will again read side effects, causes, complications. What are the factors? That is called as objective element. Got it? Objective element basically supports your standard. Yes? Let's go into the definitions. NABH 10 chapters. First chapter AAC, second chapter COP, third one MOM, fourth one PRE, Patient Rights and Education, fifth one HIC. First 5 chapters are patient-centric chapters. When I say patient-centric, they are directly related to the patient's health and wellness in the hospital. Patient-centric. The last 5 chapters, PSQ, ROM, FMS, HRM, IMS, the last 5 chapters are organization-centric, which means management-centric, administration-centric. Centric means it is focused towards the administration. Got it? Clear about the 10 chapters? We will go in further. Before going into the chapter, let's understand the terminologies basically used in NABH. What is a standard? A standard is a statement that defines the structures and processes, and it must be placed in the organization. For example, I want, okay, one standard. The organization should have the health checkup of all the employees annually. That is the standard. Correct? Health check of the employees annually. That is the standard. For that, what are the objective elements? How do you do the health check? Annually you do. How? What are the parameters used for the health check? What are the components? Age group, how do you divide for the health check? Those are your objective elements. Clear? Next, objective elements is always measurable. Yes? Have you heard about SMART goals? Nowadays it is new fashion. Everyone says what? Don't work hard, work smart. Yes? SMART goal. Specific, measurable, accurate, reliable, time-bound. Time-bound. SMART goal. Okay. So, similarly, all the goals has to be measured. Those measurable factors are the objective elements. Next is the SOP. SOP is nothing but All written documents, standard operating protocols, procedures. Yes, manuals. Indicator. Indicator is a conceptualized, at the same time, it is a measurable factor which will help us to know where we are. Example, let me talk in simple terms. Have you all heard about medication error? Yes, medication error. Wrong tablet given to wrong patient. Yes. Now, how do you know that in the last month there were only 4 medication error and not 10? Over here, incident comes into the picture. Every medication error has to be entered into incident report. Incident report is a measurable factor. It is an indicator. Total number of medication error divided by total number of incidents. Okay, this is not a proper definition. What I'm trying to tell you is total number of errors to the total number of incidents. Clear? That is the quality indicator. Next is process. What is a process? Let me talk to you in your terms. You all got admission here? Yes? In SCS college. How did you get admission? One fine day you got your result and you came here? What was there? Procedure, process. Yes? There was a process. You might have to write your exam, you might have to give your interview, contact around, how did it go? And then after that get selected. While getting selected, they check your marks. There is a process. And at times, it is first come, first in. 100 seats filled and you are 101. You can't squeeze in. It's over. Okay, there is a process. A series of steps or actions is called as a process. Okay. Similarly, in the hospital also, we have process for everything. Let it be admission process, discharge process. Clear? RCA. Widely used terminology, nothing but root cause analysis. Whenever an incident is raised, we find out why? Why did this happen? Why? Why did this happen? Why? Okay, so that is the root cause analysis. CAPA. Once the root cause analysis is done, we do something called as CAPA. Corrective action, preventive action. So correction is basically avoiding the problem from occurring. Prevention is from recurrence. Okay, it should never happen again. Done? Then audit. It is an evaluation based on set guideline. Let me stop there because it is another 3 hours topic. Quality improvement. Do you all have models? Conceptualized models you have in your studies? For example, Roy's theory, the various theories. Theories are there, theorems. So that is nothing but in quality, it is called as quality improvement. Okay, it is called as a quality improvement. What is quality assurance? Seeing that the quality is every day maintained at the same level. Assuring. That is called as quality assurance. Next is quality tools. There are various quality tools. Okay, we have read about one tool. Which tool is that? Fish tool. Fish bone analysis. Okay, fish bone analysis. So, this is another favorite diagram of quality people. PDCA. Plan, do, check, act. Whenever you see a problem, how will you prevent it? Plan to prevent. Okay? Then act on the actions. Then check. Once you act on the action, go and check. Simple example. In ICU, I see that every day there is infection. Patients are getting, after surgery, infected, what will you do? You will start looking why. Once you see why this is happening, you will plan for interventions. Once you plan for intervention, you will go and implement the intervention. What are the various interventions? It can be hand wash, it can be fumigation of the OT, it can be 1:1 staff nurse and 1 patient care. Yes? After that, after putting the interventions, you will go and monitor. Okay? Monitor whether infection rate is again high or is coming down. Monitor. And then last, take appropriate action. PDCA. Okay, remember this PDCA model. Now this is about getting into NABH. In NABH, we have 10 chapters. In 10 chapters, each objective element, 683 objective elements are divided as commitment level and core level, achievement level, excellence level. NABH inspection happens every 2 years, once. So first time when the inspection comes to the hospital, it is at the commitment and core level. After 2 years is the surveillance inspection. That is at the achievement level. Adding on to that after 2 years, that is 4 years from the first inspection, is the excellence level. So, if you open the NABH textbook, each objective element is written in blue and that maroon color and green color. Accordingly, we have to meet the objective elements. Now, coming to the first chapter, AAC, full form. AAC full form, access, assessment, and continuity of care. Yes, forget about the slide and the writing. From your own experience, what do you all understand from this chapter? Access, assessment, and continuity of care. Do you all understand something in this particular? Okay, let me give you one more example. Third year, any of the third year student, please tell me when the patient comes to OPD, what happens next? Any third year students? Third year, huh? No? Second year? Third year. When the patient is coming to the OPD in your hospital, what happens next?
Take personal information and of course admitted to consult doctor.
Okay. Then after consulting the doctor?
Treatment.
Treatment. How does the treatment happen? Like
on the causes, on the disease.
Okay. Admission takes place
Yes,
on
ma'am.
OP basis?
If depend upon problem.
Very good. You saw him? What's your name?
Tirupati.
Yes, give a round applause to Tirupati. Actually, he covered 70% of the AAC. AAC is nothing but patient is coming to the hospital. Patient came in front, went to the reception. Madam, I want to show to the medicine doctor I'm having fever. Reception person took the charge. 100 rupees, 50 rupees or 500 rupees, whatever. Madam, room number 13. The patient went to medicine OPD. In the medicine OPD, doctor saw, okay, then doctor said, you are having fever, let me do some blood test and do one chest x-ray also. And then you come back. Patient went to radiology department, did the chest x-ray, went to lab, did the blood investigations. After 2 hours, came back to medicine OPD, showed the reports to the doctor. What will doctor tell? Only 2 things, as rightly told by Tirupati, only 2 things. 1, your report seems to be normal. I will discharge you. If your fever doesn't come down, come after 2 days. 2, Your reports are slightly elevated. We will admit you and observe you. Two possibilities. Yes. So from OPD to home, forget about that. The patient got admitted. Once the patient got admitted, what happens in the hospital? Treatment is given by multidisciplinary team. It can be physiotherapist, it can be doctor, nurses, housekeeping clerk, nutritionist. Okay? The patient is getting well. Then the patient is going home. Before going home, there is something, one process. What procedure is there? Superb. Discharge procedure. Discharge procedure takes place, and then after home care medicines will be given to the patient, and the patient goes home. This is nothing but AAC chapter. Right from the patient coming to your reception to the patient leaving your hospital, it can be OP basis or IP basis, is AAC. Got it? Very simple. Access, assessment and continuity of care. Clear? I'm not going to read all that, but understand AAC is nothing but from the entry point to the exit point. Clear? Yes. COP full form? Care of patients. Very good. Now over here, the chapter widens up. AAC was just throwing gist everywhere. In COP, the chapter widens up. Each department SOPs are written over here. ICU department, nursing department, OT department, sedation anesthesia department, code blue, emergency department, nutrition department, then we have a physiotherapy department, grief, death care. Everything is in COP, care of patients. At each level or in each department when the patient is admitted, what are the protocols? How are we supposed to take care of the patient? That is written here in COP. Clear? Now, if I have to talk to you, each standard has got 10 objective elements. COP is the highest objective element, 100 plus with 20 standards. Okay? So, everywhere, each and everything has to be followed. Obstetric care, neonatal care, each department is specified in COP. Again, to sum up, just remember, in COP second chapter, it is department specific, individual department specific, whereas AAC first chapter was patient entry to exit. Got it? I'll end up COP. It is department specific. Yes? Whose mom? Very good. Management of medication. Nobody's mom. It's management of medication. So, what are the various things that we are seeing in management of medication? First of all, where do we keep medicines in the hospital? Very good, pharmacy. End of story. Where else we keep medicines in the hospital? Emergency. Where else we keep? Nurses station, which is equal to IP wards, OPDs. Yes, the medicines in the hospital are kept in various departments other than non-clinical. Medicines are not kept in billing, insurance, reception, nor in my office. It is kept in all clinical areas, OP, IP and pharmacy. One more question to everybody. Consumables are there, right? Consumables. It can be betadine, it can be spirit, and implants. All of you have heard implants? Whenever there is a fracture, ortho doctor will put a screw and Yes, that is an implant. And blood. Does this come under management of medication? Blood. Does this come under management of medication? No. Implant. Does it come under management of medication? Yes. Now what I want to tell you all is, blood is a medication to the patient. You are giving something inside the patient's veins. It is blood. Blood is also treated as medicine for the patient. Implant. Implant is also a medicine. Implants also come under management of medication. Okay, not only tablet, injection syrups, nasal drops, ointment, including implants, blood, everything is a medicine. Clear? And in MOM, they are talking all about how we keep our medicines safe, how we store our medicines safe, environment, cold storage, then high-risk medication, look-alike, sound-alike medication, then other medicines, and verbal orders comes over here in management of medication. Verbal orders as well as documentation. How are doctors supposed to write the medicines? Don't go with the recent gazette, generic drugs. No, not that. How are doctors supposed to write the medicines? Small letter, running letter, capital letter. Capital only. Where it is given in their code of ethics. Actually, MCI code of ethics. But also in NABH, it is focused. Clear? So all these things is covered under MOM. Yes? MOM basically talks about medications. Only medications and its safety. Yes? PRE, Patients' Rights and Education. So, what does PRE talk about? It talks about the patient has the right in the hospital. It's not that patient is coming to the hospital and is completely on the administration, doctors and nurses. No, patient also has got rights and responsibility. He's not supposed to eat pan and chew and throw it everywhere in the hospital. He's not supposed to smoke. He's not supposed to go to other patients' cot and sit on other patients' cot. Why? Why? Very good, cross-infection. Okay, there are so many rights and responsibilities. Visiting hours has to be followed. Every day, every time, patient attenders cannot come inside the hospital. There is something called as visiting hours. Only that time they are supposed to come. That also has to be followed. So these are the various patient rights and responsibilities. And education also we are supposed to give to the patient at the time of admission. All that things come over here, including the consent. Okay? Informed consent, general consent, all the consents come over here in the PRE. PRE also deals with department. What is a customer care department? Patient doubts, complaints, everything will be answered. For example, if I have a problem in my bank and I do the toll-free number, where do they connect? Yes, I am so and so customer care. How can I help you? With that help only it will be half an hour phone call because connection will be too much. So basically customer care also comes over here in PRE. Clear? Customer care, consents, patients' rights and education, everything is under PRE banner. Clear? HIC. The last chapter of the first 5 patient-centric chapter, HIC, Hospital Infection Control. So what are the various parameters here? How can we prevent the infection? How can we see that the area is not contaminated? Cross-infections, outborne infection, all the various types of infection. Have you heard about SSI? surgical site infection, CLAPSI, VAP, CORTI, everything is over here. Hand wash, immunization. Every employee has to be immunized. Have you all got immunization after joining your nursing? Which are the ones? Hepatitis? Hepatitis B, yes. And tetanus toxoid? Okay, depends, nothing mandatory. Hepatitis B, yes. Why? Why did they give you all? Because tomorrow you all will go to the hospital, and sometimes there are chances if precautions are not taken properly, standard precautions are not taken care properly. That is why hepatitis B is given to all the healthcare professionals. Clear? That comes under HIC. When you come as staff nurse to the hospital, they will ask, did you take hepatitis B? You will say, yes, taken. Go do the titers, get me the value of your titers. That is during your induction, pre-employment check. And if you say no, repeat hepatitis. Okay, so both are there. This is again mandatory. Every healthcare organization does it. Clear? So HIC mainly looks into documentation, cleanliness, disinfection, preventing cross-infection, hand hygiene protocol, audits, and more of the thing CSSD. Have you all seen CSSD? What is the full form of CSSD? Only first two words, Central Sterile Supply Department. Yes, where all the things are sterilized is CSSD. Even that area is covered under HIC. Okay, so overall HIC deals with hospital infection control and various components associated with infection. Done? Next chapter is PSQ. What is PSQ? Patient safety and quality improvement. Basically, PSQ talks about various indicators used in the hospital for the betterment of the hospital. PSQ speaks about patient safety. The previous hour, 45 minutes, we spoke about patient safety. 6 goals of patient safety. All that is in PSQ. Okay? PSQ, if it's going down day by day, that means the hospital parameters are dropping. Quality is dropping. PSQ should always go high. The values graph should be 98%, 100%, like that. Okay? Then only your performance is going better. PSQ is basically like a graph. Okay? Graph of growth for the hospital. This chapter. Clear? ROM. What is ROM? Responsibility of management. Let me tell you one thing. We talk big things on protocols, policies, procedures, and everything. But if the management is not supporting to implement, nothing can be done. So, management is also having a huge responsibility when it comes to NABH implementation. The responsibility right from vision, mission, quality goals, statements, everything, they have to be ready. Not only that, a vision to the organization with strategic goals has to be there. Then management has to support the organization in every step by budgets, by providing adequate training, all these things. So all these things are the responsibility of the management. Not only that, keeping the healthcare personnel safe in the hospital is also the responsibility of the management. Okay? That is why trained and experienced security is kept in every hospital. Because NABH, I told you earlier, it's not about only hospital and patient. What is the full form of NABH? National Accreditation Board for Hospitals and Healthcare Providers. Okay? If we as healthcare should require safe environment, management also has to support. Clear? So management also, there is one whole chapter. What I'm trying to tell you all is, NABH has given one full chapter for management, and under management there are 4 standards. Under 4 standards there are 17 or 18 objective elements. Yes? FMS, Facility Management Service. So, Facility Management and Safety Management. Okay. So, what is this FMS? It's nothing but a new organization. We don't have to worry anything. In a new organization, fan will be proper, roof will be proper, there won't be seepage, there won't be leakage, tile will be all nice, there won't be cracks in the tile, nothing. But an organization which is 10 years and above, you will see seepage in the building, tiles being broken, fan, you'll only see the rod. Fan won't be there. Okay. So over here, facility management comes into the picture. It ensures that not only the patient but also the staffs are kept safe. It ensures that all our patient safety devices, grab bar, side rails, belts, then anti-skid flooring, all these are in place. Yes, all these safety devices and facility management also deals with oxygen. During COVID time, you must have heard many patients died because lack of oxygen. In NABH, oxygen component comes under facility management. And facility management deals and sees that everything is proper, including the biomedical engineering. Equipments, cardiac monitor, defibrillator, ventilator, all that comes under facility management. Okay? So this is about the facility management overall and how it is helping the safety of the staff as well as patients. HRM, Human Resource Management. Human resource is very important. If human resource is not proper, that is HR department I'm talking, not human resource manpower, HR department in an organization is not proper, don't ask. There won't be training, no proper recruitments, no health checkup, no employee benefit, no privileges, nothing. Everything is no. So, HR should be very strong in the organization. Why? This is for the welfare of the employees. Indirect welfare for the patient. How? If HR is strong and good, they will recruit more staffs. So patient will be benefited. But at the same time, very helpful for the employees. HR should be strong and dedicated. Clear? HR looks into the overall well-being of the employee, right from the health to monetary benefits to all other privileges. It also looks into recruitment. Clear? So HR. This I'll go very fast. Information management system. Information management system is nothing but divided into 2. One is information technology, IT department. Other one is MRD, medical record department. So how are we maintaining the patient case sheets, records, everything is under MRD. How are we maintaining the privacy and helping for the easier work, the work to happen easier is under IT. Okay, IT is the one which supports and helps us to make our work easier in the hospital. So these are the 2 components which form into IMS. Yes? So we have seen the 10 chapters of NABH, right from AAC to IMS. We have seen some of the terminologies. Everything cannot be taught over 2 hours. In future, I'm sure you will come across this on an everyday basis and it will be easier for you all. So with this, I conclude my session. Any doubts with any of the chapter? Or we will brainstorm a little and then you can get more doubts. Everybody stand. Faculties also can stand for this. Okay, ready for the activity? Yes. Want some exercise? Yes. Hold the hands of each other. Everybody hold the hand. Yes? All are holding your hands? Yes. Now, have you seen in the park, early morning and late evenings, some people forming the group and doing what? Super, very nice. Nothing but it is called as laughter therapy. Can we have one laughter therapy session here? And remember, don't see your neighbor and don't feel, oh my God, what she's doing. No. And boys, ha, ha, ha. Okay, you can laugh the way you want, and I don't want marriage laugh here. This one, or shy laugh. No, all these things. Laugh out to the core. I should hear the sound of your laugh. Yes? Ready? 1, 2, 3. Yes. Please be seated. Settled? You know what? Students have to make noise. Then only you are all students. If I want to make noise, the society won't accept. But you all are students. You are bound to make noise. Okay? Be full energetic and filled with energy. Yes? Yes. Any questions? So thank you everybody for the opportunity, and you all have been a wonderful crowd with lot of interaction. Keep up your spirits and all the very best to you all. Thank you.
We have come to the end of the sessions. The post-test is scheduled for now. Kindly note, delegates are requested to fill the feedback form. I repeat, delegates are requested to fill the feedback form. Thank you. Good afternoon to all present here. A warm welcome to the valedictory program of this regional seminar. May I now call upon Mrs. Frida D'Souza, the resource person, along with the other dignitaries, to occupy their chairs on the dais. I request Ms. Anne Mary Thomas to escort the dignitaries. A round of applause, please. May I now call upon Ms. Delisha Carol D'Souza, delegate representative, to give a feedback on the sessions of the seminar.
Respected Speaker, Principal, Organizing Committee, lecturers and everyone present here. There is a saying, tell me I forget, teach me I may remember, involve me I learn. This was once a seminar where we all were involved in learning and sharing knowledge. We all liked the range of different topics. The speaker was very interesting. The seminar was successful because of the practical focus. We came to know about the use of quality indicators in the health sector to track the clinical performances and outcomes, to measure and provide the quality of care to the patient. We also came to know about the accreditation, certification, patient safety, about the 6 goals, emergency code, and NABH, especially about the 10 chapters. Thank you so much for organizing this. It was very informative and successful one. Thank you.
Thank you, Ms. Delisha, for sharing a positive feedback. As the names of the student representatives from each batches are called out, I request them to come forward and receive their certificates of participation. I request Mrs. Frida D'Souza, resource person, to distribute the certificates. From first year GNM, Ms. Ria Anna Chaco. First year BSc, Ms. Princey. Second year GNM, Ms. Rosmin. Second year BSc, Ms. Riva Zita Paul. Third year BSc, Ms. Namita. Fourth year BSc, Mr. Abhinan TV. And the faculty representative, Mrs. Rajeshri. Thank you, ma'am. The essence of all beautiful art is gratitude. May I now call upon Ms. Suni, fourth year BSc nursing student, to deliver the vote of thanks.
Good afternoon, everyone. I, Suni Pilipos, feel very privileged to be able to present here, and I have been asked to deliver the vote of thanks. To begin with, I would like to thank our resource person, Mrs. Frida D'Souza, who has taken time out of her busy schedule to deliver a talk about quality indicators in healthcare. I take this opportunity to thank Dr. Amarnath Sorake, Founder President, Dr. Rajani Sorake, President, and Dr. Abhinay Sorake, Secretary and Presiding Officer of today's function. I extend my thanks to Mr. UK Khalid, Administrative Officer, SCS Group of Institution, for all his support. Next, I would like to thank our Principal Professor, Mrs. Lolita S.M. D'Souza, because of whom this seminar was possible. Our Vice Principal, Mr. Anil Kumar, also helped in the organization of this seminar. A special thanks goes to our teachers, especially Mrs. Ambika JR and Mrs. Shifali, the organizers of this seminar. They also motivated the students to participate and organize this seminar. A heartfelt thanks to our Student Organizing Secretary, Ms. Jerin Thomas, for coordinating all the committees of the seminar and working for its success. I would like to thank each and every student of 4th year BSc Nursing, my batchmates, for their support and hard work, which made this event a grand success. Today, around 150 students participated in this seminar. This made the seminar a grand success as it attracted the attention and motivated the students to learn and explore on the theme. In conclusion, I would like to say that this event would not have been possible without the support of each and every one of you. On behalf of the 4th years, I would like to express my sincere thanks to all of you. Thank you.
Just to make a mention here, apart from the seminar, we had the release of the anthem also. So I would like to thank Mr. Rohan and Mr. Akhil along with the other faculty and Louis, our student, who has helped us in releasing this anthem and they have worked for it. Thank you.
As we come to the end of the regional seminar, I would like to thank the management, faculty, and especially the 4th year BSc Nursing students for putting their utmost efforts in making this seminar a grand success. See you all next time. I, Rekit Macklin Pinto, your pitchman, signing off. Kindly note, the prize winners of the state level competitions are requested to stay back for a quick photograph. I repeat, the prize winners of the state level competitions are requested to stay back for a quick photograph. Thank you.